So to open this morning, I'd like to introduce and invite to the podium Jan Bergen, President and CEO of Lancaster General Health and Penn Medicine. I think everyone here knows Jan. She provides leadership to our organization, but most of all, what I would like to call out is that Jan has been a role model and a mentor of mine for many years. She always puts the community and the people that we serve first, and she leads a brilliant example for us in our health system. Jan.
I made it. A little worried about these heels this morning. Not brilliant planning on my part. Before I offer my formal comments, I'd like to recognize some people that are with us this morning. We're grateful to have all of you here. We have a couple of people, though, I'd like to specifically call out. I believe that State Representative Steve Vensker had to leave, but if I'm wrong, please wave your hand. I saw Mike Sterla, Representative Sterla. Mike, thank you for joining us today. Welcome. I believe that we have all three of our commissioners. I saw Josh Parsons. Josh?
Right here.
Thank you. Commissioner Lehman, thank you for being here. And also Commissioner Stuckey, thank you for being with us as well. Lancaster's Mayor, Rick Gray. Rick, I know I saw you. You're hiding behind John. Nice to see you, sir. Lancaster City Councilwoman Deneen Sirachi. Deneen, I saw you too. Nice to see you. Ralph Mueller, the President and CEO. You don't have to stand, Ralph, please. University of Pennsylvania Medical Health System. I'm sorry, Ralph has an injury, so I don't want him standing on this soft ground and getting re-injured. Phil Wenger, President and Chair of our board. Thank you. We have several other members of our board here. If everybody could just wave, please. I think it's so important for you to see the representatives of the community that help lead this amazing organization. So thank you. And wow, what a difference 15 years makes. If you go back in time to 2002, we would be standing on an old, aging Norfolk Southern rail yard, literally. You'd have to go a little west now to find where the new rail yard is. But that's what came through this swath of land. You would also, to our right or to your left, there would have been a lot of aging Armstrong World Industry floor plant buildings that were in the process of being vacated. And around that same time, there was a coming in the minds between Franklin and Marshall College, Lancaster General Health, and Armstrong World Industries, who created a vision to create the Northwest Gateway, which was to essentially take all of the brownfields and to remove the rail yard and to relocate it so that we could create green space that could accommodate an expansion of medical and educational resources throughout the city of Lancaster. It is amazing that we are able to stand here today. And as an individual who was intimately involved in that project, I need to really make a call out to somebody who is not here today, and that is Keith Orris, who was the project manager throughout the 15 years and managed the largest brownfield project in the United States. So call out to Keith, please. And since then, we've done a lot to advance that vision of creating this medical education corridor. And first, I'd like to congratulate Franklin and Marshall on their stadium, which you may have seen on the way in, that is under construction. I know that was their first major project that they wanted to undertake on this new land. We also have the Y in the last 15 years that relocated its downtown facility off of Harrisburg Pike. And the Y is a really important community partner of ours, advancing health and well-being of the community. So we were thrilled that they became part of the Med-Eds corridor. We have the Heart Group, and that building that Lancaster General and the Heart Group as a consolidated organization has been able to continue to expand and add new services. We have the new health center that Franklin and Marshall and Lancaster General have done together to really deepen the scope and depth of services that we can provide to Franklin and Marshall students. So there's a lot that has already happened. And of course, we're here today to celebrate yet another major investment in the Northwest Gateway, and that is to finally be able to address the behavioral health needs of this community in a real and meaningful way. So we are standing where a 126-bed facility will be erected that I really truly believe will make a big difference in the lives of people in our community. We are recognizing as an action with the creation of this facility that mental health is a very complex issue that touches literally everyone in our community. It could have been through a personal experience, it could be through a family member or a coworker that has a mental health concern. As a result of that, there is a significant demand in our community for behavioral health services, which certainly regrettably outstrips the capacity of us and our community health partner providers. Demand for inpatient care remains at a very high level, and our 36-bed inpatient unit today simply is full most days and cannot keep up with the demand that we see. It is the only unit in Lancaster County today that serves all people irrespective of their ability to pay. Patients routinely that come into our emergency room that need placement in an inpatient facility are sent to facilities outside of the county, placing what we can all imagine to be a very tough strain on the family members who are trying to support their loved ones. You may be interested to know that in the recent community health needs assessment that we did, we learned that literally 1 out of 5 Medicare beneficiaries are being treated for depression. We also know that over 35% of the children and adolescents that we care for in our pediatric practice are suffering from some level of anxiety or depression. This is a real issue in our community that we're just thrilled to be addressed. And in relationship to that in the pediatric and adolescent population, there is no one in Lancaster County that is currently providing inpatient services for children. As a result, families are traveling outside of the county, many times outside of the state, for treatment. Each year, just at Lancaster General Hospital alone, more than 550 children are referred out of county or out of state for services. I know from many conversations that I have had with family members what a devastating impact this has on their family and for the re-entry of that child back into the community. Several years ago, through our whole process of identifying priorities that are related to needs in our community, we set behavioral health as one of our top 3 priorities. And at that time, we made a commitment to do 2 things. One, we wanted to develop a comprehensive inpatient facility that would be able to meet the needs of specialized populations. Second, we made a commitment to put behavioral health counselors into our primary care practices to support those primary care physicians and their teams in caring for people, particularly that are suffering from stress and anxiety. On the inpatient front, we felt very strongly that we wanted to build the capacity to care for specialized populations. So we will be building a 126-bed facility that has the ability to care for adolescents. It will also have a psych med unit for medically complex patients, a dual diagnosis unit for adults who are dually diagnosed with both a substance abuse as well as a psychiatric illness, and a women's trauma unit for sexual assault victims or for women with a history of traumatic injuries because of domestic violence. The hospital is also going to have 2 different levels of outpatient services, a partial hospitalization and a day treatment program. We felt very strongly about that because we want to prevent unnecessary hospitalizations, and we also want to be able to shorten the length of stay that somebody has to be in an inpatient environment. We feel that the inclusion of those outpatient services will help with both of those. So since identifying and planning our response to this incredibly pressing community health issue, we sought a partner. We went out and sent out a request for proposal and sought proposals from companies like UHS, who we ultimately selected as our ideal partner for this complex need in our community. Universal Health Services is a nationally recognized organization with the depth and breadth of experience to enhance our community's access to both cost-effective and high-quality behavioral health care. They're headquartered in King of Prussia, not more than an hour from here, and they operate 240 acute care hospitals, behavioral health facilities, and outpatient centers, not just across the U.S., but across the nation and the world. 9 of their facilities are located in Pennsylvania. UHS joins us in having a deep commitment to the communities where patients live and work, and they are very active in raising awareness of critical healthcare issues. Over the past 3 years, I found it very interesting to learn that they had invested more than $1 billion in their facilities across the country. Before closing, I want to recognize the municipal support that we've received from Lancaster City and Lancaster County while the project was in its complex planning stage. I also want to thank our neighbors, our current and future neighbors, who provided us valuable feedback during the planning process that will ensure that the facility is an asset to the community where they live and work. Additionally, I'd like to recognize how much President Porterfield and the leadership team at Franklin and Marshall College has served as tremendous partners in developing the Northwest Gateway. We are so fortunate to have the college as a committed advocate that shares our desire to strengthen the health and well-being of the community that we serve. An exciting road lies ahead. I look forward to watching the hospital grow from its strong foundation, and we'll look forward to joining you all again next year as we celebrate the opening of this critical community resource. So next, I would like to welcome to the podium the Pennsylvania Secretary of Health, Karen Murphy. Lancaster General Health and all of Penn Medicine, as well as Universal Health Services, appreciate the tremendous support that Governor Wolf and you, Secretary, have provided to us through this entire project. Your backing will ensure that the Lancaster Behavioral Health Hospital will stand as a best practice model for others around the state. Please join me at the podium. Thank you.
Like Jan, the biggest accomplishment I may have today is making it to the podium and back to the seat with high heels and a reps. Thank you very much for that warm introduction, Jan. And on behalf of Governor Wolf, I'd like to congratulate you, the Board of Directors, Mr. Mueller, for this tremendous, tremendous accomplishment. As a nurse, I've worked in healthcare for quite a long time. And I think we're finally starting to see behavioral health be given the proper attention and funding that it deserves. We have come to realize in healthcare that physical health is not the only component, nor is it the only part of health that is our responsibility. I was speaking to Jan earlier, and I think you heard another word that Jan used quite frequently, and we think we share the vision for communities coming together. And this is an example, as you heard Jan say, of a community coming together to address the health needs of the population. Again, on behalf of the governor, we're so happy for you all today to celebrate this tremendous accomplishment and look forward to seeing your great work. The governor believes in investment in behavioral health. His current budget allocates additional funding to community health, community behavioral health services, and also through Medicaid. So I'm very happy to be here. I will share with him the great work that everyone is doing, and please continue, and I wish you all the best.
Thank you, Secretary Murphy. Before I introduce the next speaker, I would like to say to the group that have been at Lancaster General for many years, but only really involved with behavioral health for the last 5 or 6 years. And the importance of behavioral health in this community, the essentiality of it, has really been raised in my knowledge and awareness of what needs to be our focus here. We did not get here, and what I certainly found in mental health is partnership. Many of the people that we partner with are in this room today. They're independent businesses, they're members of Health and Human Services, members of departments within our county and city government, and without them, there is no way we would be here today. It has been an iterative process where we have tried to listen to everybody's viewpoint and perspective and changed our ideas, our plans moving forward to get to where we are today. The person I'm about to introduce is one of those partners. I would like to welcome Lawrence George, who is honored to serve as the Executive Director of Lancaster County Behavioral Health and Developmental Services. He's a graduate of Millersville and Temple Universities and proud to have just celebrated his 27th anniversary in County Human Services, where he's part of a progressive and collaborative mental health community that prioritizes wellness, particularly for those in the most need. Larry, along with agencies and providers throughout our community, and we greatly appreciate his counsel and support, and we're very delighted that he decided to join us here this morning. Please join me in welcoming Lawrence George. I have a hard time not calling you Larry.
I asked Stacy to introduce me as Lawrence for my mother's benefit, so thank you. But yes, please call me Larry. It seems only appropriate that the groundbreaking for this new facility is occurring during what has been celebrated since 1949 as Mental Health Month. This tradition was begun to educate the American public about mental illness and mental health, a daunting undertaking at the time, considering that the first edition of the Diagnostic and Statistical Manual classifying mental illnesses, more commonly known as the DSM, wasn't published until 1952. Sadly, it's not difficult to imagine the general ignorance that then existed regarding mental illness and the popular attitudes and prejudices held by many towards those who suffer. For all of the subsequent advancements in our understanding of brain chemistry and the social and biological underpinnings of mental illness, and despite the profound improvements of medications to manage previously debilitating disorders such as bipolar, depression, anxiety, and even schizophrenia, stigma and shame remain powerful deterrents to seeking help. This is especially true for those in the throes of an addiction or who are experiencing the residual complex effects of trauma, two conditions which are often deeply intertwined. As enlightened a society as we'd like to believe we are, and as progressive a healthcare system as we'd like to think we have, our collective ill-preparedness for the opioid epidemic should serve as a humbling, if not tragic, evidence that ignorance and stigma are not remnants of another era. Mental illness and addiction are not choices, but recovery from them is. The facility to be established on this site will provide Lancaster County residents recovery choices that do not currently exist, while also increasing accessibility to mental health and drug and alcohol services already being delivered by the county's robust provider network. On behalf of Lancaster County Behavioral Health Developmental Services and the county commissioners, I would like to express sincere gratitude to Lancaster General Health and Universal Health Services for their joint vision and commitment to meeting the county's wellness needs. I believe the Lancaster Behavioral Health Hospital to be the finest evidence of celebration of Mental Health Month. Thank you.
Thank you, Larry. Before I introduce our next speaker, we really would not be doing justice to this groundbreaking ceremony without hearing from someone in our community who firsthand has experienced what it means to have family members who you're not able to find the kind of care for that you would really desire within this county. So I'm pleased to introduce our next speaker, Jerry Ann Johnson. She has witnessed firsthand the challenges and heartbreak that mental illness can have on a family. She is an advocate for patients. She retired after working 26 years with Abbott Laboratories, where she represented national and international cardiology forums. She also volunteers as the leader of our Women's Heart Health Support Group at Lancaster General. She is a Lancaster native and holds a Master's of Education degree from Millersville University, where she is very active. Please join me in welcoming Jerry Ann Johnson.
Good morning, everyone, and what a good morning it is. Well, thank you, Stacy, for that nice introduction, and thank you for the opportunity to speak on behalf of behavioral health and mental patients and their families across our community. As others have mentioned today, this day has been a long time coming. The need for a hospital dedicated to delivering a broad range of mental health services in Lancaster County is abundantly needed. As someone with multiple family members, going back to my beloved aunt, for whom I was named, she got this whole bad thing started, and many friends who deal with and have dealt with mental health and substance abuse concerns. I can personally affirm that families across Lancaster County have been waiting for this day to happen. This is their day, and this is your day. It's an honor to be here to witness the start of this project. After reading yesterday's paper, it's clear that not just that this speaks to the heroin epidemic, but there are countless family members who could be standing here and giving this talk, and I'm very honored to be the one that was asked to be here. In reflecting how mental illness has impacted members of my family, including all three of my children, one who just passed away in September, I'm reminded of the tremendous value of having adequate resources in one's community. Families experience a lot of pressure when faced with taking loved ones to hospitals and outpatient treatment centers, and all too often, even as these diseases progress, it also can involve visits to prison when things get really out of hand. I was fortunate enough to have the means to travel and visit my family. I used to fly 300,000 miles a year. So if any of you do much flying, you know that's a lot of frequent flyer miles. My children are very sad that I'm retired. Where's those miles? But I was very fortunate. But for most of our community, probably 90% of our community, that's just not possible. And not only is the situation heartbreaking for families, but it's detrimental to the health and well-being of the mental health patient. Family support is critical during treatment and helping to return to activities of daily life. Now, trust me, that support is not easy. It can take you to hell and back, but it is critical that we provide some type of support in order to achieve, in many cases, a successful outcome. I remember my son telling me, my one son suffered from bipolar, and he had tried to hide it from us and had several hospitalizations and inpatient treatment things, and finally he included us in this, and we sat knee to knee out of bed in a hotel making the decision together. And he said, the only thing that saved me, Mom, was the support that you gave me. He said, I couldn't have done it alone. You gave me, I knew that you still loved me and were there for me. And he remains very grateful for this. Now, this is a part that I'm really excited about. That same son that has bipolar disorder is disabled with heart disease. He had his first heart attack at 28. I can tell you that the fact that this hospital will have a med psych unit is huge. I cannot emphasize that enough. My son sat in a hospital for 2 weeks because no mental health facility could give him the cardiac care that he needed. So they refused to take him, no matter how off the charts he was. And, you know, it involved him being restrained and a lot of really ugly things. So I can't, the first thing I asked when I heard that this new project was being built was, will there be a medical med psych unit? And you're so to be congratulated on this. This is so huge. My kids were born into families with serious heart disease, and so, you know, sometimes he would be admitted for a heart problem and then become psychotic. But the heart always trumped over the mental health issue. So as a result, he'd enter a behavioral health program in the hospital. Within a day, his heart would go nuts, and they'd shift him off to a cardiac unit. So his mental health care really suffered from that. So I think that it really is important that you have that, and I'm just so proud because I know my son's cardiac or mental health issues advanced because of his inability to get this care. So you really get an A++. So the med psych unit will enable the whole patient to be cared for. Optimal care delivery often requires innovation, and perhaps you and I know with what LGH and United UHS are bringing to this that you will really make this the best. Optimal care delivery often requires innovation. You're going to be a leader of that innovation. I want to address the stigma of mental illness. A lasting value of today's event in this hospital is that it further opens the discussion and the conversation around mental health. And with dialogue comes the necessary and long overdue stigma surrounding those with mental health concerns. Prior to my job with Abbott, I was a 5th grade school teacher. Now, for 10 years, if I asked any of my students for 10 years, what do you want to be when you grow up? Not one of them would say, oh, I think I'll be a paranoid schizophrenic, or I'll have bipolar 1, or oh, I want to be a heroin addict. This is not a choice. This is not a choice. No one chooses to have these horrible illnesses. For too long and for too many, fear of that stigma has prevented people with real issues to seek support and treatment. Mental illness is perceived as a sign of weakness, but I can tell you there are numerous personal accounts of psychiatric illness where shame overrides the most extreme of symptoms. Shame leads to secrecy for both parents, patients and family, and the secrecy becomes an obstacle. I often wonder if my son had come to us, you know, he lived in Wisconsin, had he engaged me earlier, could we have, you know, perhaps closed a gap a little bit. So unlike physical illness such as cancer or heart disease, when social resources are typically and very gallantly mobilized, people with mental disorders are removed from potential supports and are shunned from their families and support systems at a time when they need it the most. I suspect everyone here in this room, if they would admit it, has been touched in some way by some form of mental illness. I can tell you that since I have opened my dialogue, I cannot believe the number of people that I've met that are in the same boat that I am, and I never realized it. So while with Abbott, I worked with the Partnership for a Drug-Free America. At one time, I worked on a drug that was used for acute mania. It now has a different name, Partnership for Drug-Free Kids. And my job was to safeguard ways to prevent abuse of a product that we made that was a painkiller and highly abusive. While countless people benefited from this chronic pain relief the drug provided, far too many abused the drug. And for many young people, I have to, you know, we had a very strong grassroots effort to educate parents. A lot of times your kid's first exposure to Vicodin or whatever is in the medicine cabinet, or in my mother's case, right on her kitchen table where all her healthcare providers came. So lock it up. In my work with this organization, I met a mother who had 2 daughters with health concerns. One child faced the challenges of epilepsy, which is a horrible disease. The other child had a substance abuse problem and was a drug addict. For the child with epilepsy, the mother served as an advocate. She sought the best of the best treatment, the best physicians, the best providers, the best, anything that she could get. But to ensure that her daughter with epilepsy had the best outcomes she could have. But for the child with addiction, it was just a constant fight. And the mother didn't, the mother kicked the daughter to the curb and said, you've got to stop this, you've got to get over this, blah, blah, blah. And she just couldn't understand why her daughter just couldn't stop using. Well, sadly, I think you probably know where this is going. She lost the daughter who had the addiction problems. She no longer lives on this earth due to an overdose. And this very brave mother told me, it took that event to make me realize that she was just as sick as my daughter with epilepsy. The same holds true with mental illness. It's just that. An illness, mental illness, an illness like heart disease, cancer, or asthma. No one would choose to develop asthma, to develop diabetes or heart disease. No one makes that choice. So I would like once again to thank you for inviting me here, and thank you for the support that you provide those with mental illness and behavioral health issues in our community. I encourage you to continue building upon the spirit of collaboration within our community. It can't just end at one facility. Continue to open constructive dialogue about mental health issues. Look up into your family tree and have a dialogue with your grandchildren. Talk with your grandchildren and children about these dangers, and engage patients and families alike in ways to become advocates for the cause. Lancaster County is so fortunate to have the depth and breadth of services and providers available and the opportunity to set the standard for other communities across the country. Let's raise the bar high. Lancaster is great. Let's set the standard for the rest of the country to follow as a model. Thank you very much.
Thank you, Jerry Ann. Before I introduce our last speaker, I just want to take a moment to talk to you about partnership. So when we as an organization had an idea, a compass point about what direction we would like to go in to help support what we were finding as a result of our community needs assessment, as well as feedback from members of our community, we made a decision to go through a process of evaluating a partner. And it was a fairly substantial process. Our clinical teams went on site and evaluated care. We sat in a lot of meetings with leadership of organizations and talked about what our vision was, but more importantly, what we talked about was what Lancaster General Health and Medicine has been for the Lancaster County community. And we were interested in finding a partner who could make that same level of commitment to care for everyone in our community, regardless of their ability to pay, and to provide services that truly were innovative and on the cutting edge. We were very pleased to not just find a partner in UHS, but for UHS to trust us that we are the first 50-50 partnership that they are doing as an organization, because they so believed in what we were able to do in our community. So it's my pleasure to introduce Debbie Osteen. Debbie is the Executive Vice President of Universal Health Services, and she is the President of their Behavioral Health Division. Under her direction and leadership, the division has strengthened its commitment to partnering with local health systems and hospitals to ensure that individuals and families have access to high-quality behavioral health services in their local communities. Please join me in welcoming Debbie Osteen. I'm another one of those people that wore heels today. Well, good morning. It is my pleasure to be here today with all of you as we celebrate an important milestone. There's been a lot of hard work that has gone into today and more work to come. But I want to thank Lancaster General Health Penn Medicine, and I'm very excited that we really are embarking on a journey together, and I see this as an important milestone, not only for us and our partnership, but for the residents of Lancaster County and the surrounding area. I would like to thank Jan Bergen, Secretary Murphy, Larry George, and Jerry Ann Johnson for their earlier remarks, and also for their recognition and the commitment to meet the growing needs of the behavioral health community here and for those that are going to access care. Today's ceremony is more than a symbolic gesture. Today, we honor the commitment that we are making together to ensure that the local residents will have the access they need and deserve. And they need and deserve access here in this area. And what they deserve is high quality, compassionate behavioral health treatment. And that's our commitment, and that is what we will deliver. This new facility comes at a critical time with demand for behavioral health and substance use services. Millions of Americans and families live with psychiatric and substance use conditions every year. And what's disappointing to me, and I know it is to you, is that 57% of adults with mental illness receive no treatment. 64% of youth with depression are unable to access services. That's disappointing to me, and it's shameful. And as a nation, I think we all know what happens when there is no access to mental health by individuals, and what happens when those needs are not addressed. The opioid addiction is a public health crisis, and it's a crisis in the United States, but also here in Pennsylvania. We've been hit hard by this epidemic. In 2016, there were 117 fatal overdoses in Lancaster County alone. Individuals and families need to have access. They need to have access for treatment of mental health and substance use disorders in the communities where they live and where they work. And these are treatment options that can save and transform lives. They make a difference. I'm so proud that Universal Health Services and Lancaster General Health are partnering to address these critical needs. I can't think of a more impressive organization with which to share what I think is an amazing opportunity. And I'm very excited for the vision that this system undertook and all the work that went in to what we have today, which will be a state-of-the-art behavioral health facility. For 124 years, Lancaster General Health has been an integral part of this community. And its leadership and its talented staff bring exceptional clinical strengths, strong local relationships, and an unwavering commitment to the healthcare needs of residents of Lancaster and the surrounding counties. Universal Health Services with behavioral health facilities across the country. We have 9 here in Pennsylvania, has a proven track record with health systems nationally to provide innovative, programs and services. And we also have a track record of building state-of-the-art facilities. And that's what this community deserves. And that's what they will get. And that's what you will get together. Our combined expertise will allow the Lancaster Behavioral Health Hospital to better integrate the behavioral health and physical needs of its patients. You spoke about that earlier. Jan also mentioned it. And we will have, as several of the speakers have mentioned, the first medical psychiatric unit in a freestanding hospital in Pennsylvania. And this new hospital will also offer specialty programming. And Jan mentioned the units that we will have here, which include dual diagnosis for adults. And those are adults that have a psychiatric illness and also a substance use disorder. We'll have a unit to treat older adults and a women's trauma unit. And I'm very pleased, as we think about the needs across the country, that we will have a dedicated adolescent unit so that young people that need care will not have to travel. They will finally be able to receive care close to their family and close to their loved ones. That's what they deserve. So today, I'm very excited to celebrate a new chapter in behavioral health treatment in Lancaster County and the surrounding region. I would like to personally thank each of you for coming, and I ask for your continued support as we work together to make access to quality mental health treatment a reality. We have the opportunity to join together to make a lasting difference. That is our mission, and I look forward to our future together. Thank you. As we wind down here, I want to recognize so many people in this room. Obviously, I could probably stand here for a solid 10 minutes and start listing names of all of the people at Lancaster General and UHS in this community who have been a part of this project. But I think more importantly, what I'd like to acknowledge is mental health is finally becoming the focus that it needs to be. People are understanding how important it is and that people do not live separated into two sections, their physical health and their mental health. We live as one person and we have to treat people as one person. There are many people in this room who have been advocates in this community through either their leadership of their businesses, through advocacy because of their family members or their friends, because their parents who have not been afraid to speak up, and patients who have fought through the stigma that others might think differently of them if they understood that they had a mental health condition. It's because of all of those many, many years of dedicated advocacy and work that we're even at a place today where we're going to be able to launch something that in my mind is just the beginning. There's going to be so much more over this next decade that we're going to be able to do together in this community to make a difference. So thank you everyone for coming this morning. Thank you for all of our speakers. One key resource in this whole project that we haven't mentioned yet is Warfel Construction. Are the guys from Warfel here? Raise your hands. Obviously, without these gentlemen and ladies, we would not have been able to turn this into a reality, so thank you. I know that some of you have been asked to participate in the groundbreaking and posing for pictures, so I'm going to ask John Lyons to come up to the podium and tell us how he's going to coordinate all that. For those of you who aren't in the pictures, please join us for food and beverages and celebration. And once again, thank you so much, John.
Thank you, Stacey. We invited 150 of our closest friends this morning. So we're going to be doing the groundbreaking in stages. If you've got a blue card, you'll be the first up to break ground. So actually, I'll invite those folks who have a blue card that you might have got this morning to come on up to the front. Next then will be yellow, green, and then our friends from Warfel. Now you certainly can break ground at your house if you'd like this afternoon. Feel free to just take ground and throw it in potted plant of some sort. But again, those of you who received a blue card, feel free to come up. By the way, the dirt is dry, not mud.